You know, anxiety is different in dogs than it is in people, but actually, in a lot of ways, it's the same. It's a problem on the cellular and neurotransmitter level in the brains of both species. It's not very much fun. I mean, most of us have a problem with it of varying degrees. Well, it's actually good for us. We're programmed to have anxiety, every one of us. Being a little bit nervous about what might be lurking around that next corner is actually a survival adaptation. In case we haven't met, I'm veterinarian Dr. Jeff Nickel, along with our family dog, Miss America. This is Tony, one of our kitties, and Gaston, he'll be showing up at some point. I'm residency trained in veterinary behavior medicine. It's all I do in my practice anymore, but I have many years in general medicine, and so veterinary medicine is, well, that's what I'm all about. And I want to today answer any questions there are about anxiety in dogs. Separation anxiety is certainly a big one, but there are lots of other ways that dogs can be just challenged with this problem, and they can be miserable with it. And in fact, there are people who aren't very happy with it either. So tell me if you've ever had a dog with a problem with separation anxiety or anxiety of any kind. We'll talk in just a minute about the kinds of the symptoms, the indicators that you'll have that your dog has a problem like that. So I want to hear from you. And by the way, if you can hear me loud and clear, I need to know. Hit the wow button if you don't mind. And if you find this information helpful, send me some hearts with the heart button. But most of all, if you have questions, please put them in the comment line and send them out. I have some that people have sent in already, and so we're going to be talking about those. In fact, I printed a picture of one of these dogs that people sent because it was just so darn cute. So we'll get into that one too. But if you have anything like that in a pet you've known, or if you have a friend or somebody in your family with a dog, thank you for those hearts. Now I know that somebody finds this useful already. If you have somebody in your family or a friend who has a dog with separation anxiety or any anxiety disorder, please tag them, because you can see this, or they can see this Facebook Live later. It'll stay on the Calmer Canine page indefinitely, and you can post questions there later too. So by all means, let us know you're here and send those questions. Interrupt me anytime. I'm happy to have it. So, let's talk a little bit about anxiety. It can be such a big problem for some dogs that they're miserable even when their people are at home with them. We can see this, for example, sometimes when people have guests or when dogs are riding in a car. Many dogs have a problem with being anxious in situations that just are out of the norm for them. It's not something that happens every day, and so they're only relaxed when things are the same. Dogs love predictors. We do too, but more than, this is Gaston here, by the way. So when something changes that they can't predict, that they didn't see coming, it can ratchet up their anxiety, and some dogs can become reactive aggressive when there are visitors and somebody who they're real uncomfortable with and they want to create distance. We'll talk a little bit more about that too. But the Calmer Canine device, and let me just show you this briefly. This is something that is meant to target the amygdala, the fear and anxiety center of the brain near the back of the head on dogs. It puts out a pulse electromagnetic signal that adjusts what's going on in the neurons. And in fact, Miss America here, girlfriend, did you sit up, sweetie? She's wearing this little vest. You may not be able to see it because it's the same color as her dark fur. But right behind her head, there's this Velcro patch. And you put the device, we sometimes call it a halo because we really want them to act like angels some of the time. And this thing sits there and has no sensation associated with it. And they can wear it for, we do the treatments twice daily, and they last 15 minutes. You push the button on this thing, and it flashes to let you know that it's functioning. And after 15 minutes, it turns itself off. And you put this thing on the dog twice a day. You can just sit with your dog, watch television, answer your email, whatever. We'll talk a little bit more about it later. But it's a wonderful new treatment. It's FDA approved, it's well researched, and it's been very helpful for separation anxiety. And as much as that's what the FDA approved it for, we've actually started to see benefits for other kinds of anxiety. So we're not officially recommending it for other kinds of anxiety, only to tell you that we've seen benefits. And frankly, many dogs with separation anxiety also have other forms of anxiety too, which isn't a surprise because this is an internal problem within the cells and the neurotransmitters in their brain. So if we can make a change with that, we can improve lives. And so what about separation anxiety in particular? How are you going to know that? Well, dogs, many times the neighbors will complain that your dog's barking and crying while you're gone. It can be continuous or intermittent. And if you shoot a video, and we'll talk about how you can do that real simply, you can find that your dog is pacing and panting while you're gone. Many of them are doing what we call watchful waiting, where they can push the curtain or the blinds aside at the window and see where you left, where you drove away. Many times they'll stay there for most of the day or leave and come back, repeat. These dogs aren't happy. They're not restful. They're not peaceful. It's not the well-being that you want for a dog you love. And we need to know this stuff, or we're not going to realize that it's there. Of course, some dogs make it obvious that they have separation anxiety. I mean, they're demolishing the house. Usually, they're doing damage to the window where they can see, and they're pawing at it, and some will tear down the blinds. Some dogs will rip at the doorknob or the sheetrock next to the door, trying to escape and follow their person. And this is stuff that's obviously can get expensive to repair, but you're not going to miss those signs. And of course, the dog who house soils when their person is away. And you think, oh, there's a house training problem. If your dog only urinates or defecates in the house while it's home without a person, and all other times is well house trained, it's very likely an indicator of separation anxiety and is not going to be fixed with house training. It needs treatment directed at the separation problem, which again, the Calmer Canine can be very helpful. So, other things that you need to be concerned with, some dogs are going to harm themselves. They will lick excessively. And, oh, Amy, thank you for coming. And we're starting week 3 with the Calmer Canine. So, Amy, have you seen changes so far? Many dogs, they will begin to improve within several days of these twice daily 15-minute treatments. Others take 4 to 6 weeks. You don't know for sure, but until you try it. But usually a 4 to 6 week treatment is valuable even if they start showing improvements sooner. So I'd be interested in knowing if you're on week 3, so let me know what you've got so far for observations. And I hope you're using a video camera so you can tell. So anyway, I've got some questions that people have sent in, and that's great. Yeah, well, we're going to find out. Amy's going to tell us how the treatments are going. So let me read a few of the questions that people have sent in already about their pets. And I'm delighted to know that some of these had nothing to do with separation anxiety, because there's more to behavior disorders than separation, although that's a huge one. So here's one from Jenny. And Jenny says, I have a 2-year-old Boston Terrier. His name is Percy. Absolutely love him. These Boston Terriers, I've got to show you the picture of Percy, because I think he's delightful. He's dressed for the occasion. There he is. Do you see him? Maybe what a handsome little guy with that little cute head turn of his. He might have just jumped out of the laundry machine there. He's wearing that beautiful little vest. So anyway, here's Percy. And we rescued him at 8 months after being surrendered at the veterinarian's office. And he had a prolapsed rectum, which is not very pretty, and they are miserable, and they can't defecate when they've got that problem, and it is particular to that breed, by the way. And so Percy had surgery, and he recovered very nicely, and they usually do. But you don't let those things get out of hand, by the way. You take those in right away. Surgery was a success. My question is about his anxiety in the car. We have a 3-year-old Boston Pommer, it's another variation of the Boston Terrier, who loves the car. We love taking both boys in the car. After about 2 months of living with us, excuse me, gentlemen, Percy started panting and trembling in the car. I've tried everything, singing. Well, I'm not going to, talk smack about your singing, Jenny. I bet it's really pretty darn good. But if I were singing while Percy was riding in the car with me, he'd have a lot of reason for anxiety because he couldn't get out of there fast enough. But that's just my singing. So she's tried singing, the air conditioning on, the window open, the radio off, everything. He prefers to sit with me, which is absolutely fine. I've tried a thunder shirt, and Jenny, you can try a thunder shirt, and You may feel better while wearing it, but they're actually meant for dogs, so I just want to give you a little clarity on that. I currently have him on hemp chews once daily, and I've tried CBD oil, which again, if the CBD oil, maybe he's miserable and you don't even notice anymore because of the CBD. But actually, let me get serious for a second about CBD. We don't yet have any reliable research on it. It's very commonly used. Haven't seen any problems, and none of my colleagues in the behavior specialty have reported any, but we don't know. We don't know really how to dose it. We don't know if it interacts with other medications. There is a significant research project going on at the Veterinary Teaching Hospital at Colorado State right now. It's probably going to be a couple years before we see any results. So far, I'm not recommending it because I don't have the research to support it, nor do we really understand exactly how it works in the canine brain, and we don't really know exactly how to dose it. Because it's not really a drug, it is not regulated by the Food and Drug Administration, so it is not subjected to real rigorous scrutiny in terms of its safety and purity, so at your and your dog's risk. So I took him for a ride Monday, and he panted the whole time. When the car stops, he stops panting. Do you have any suggestions for me to try? I'm working so hard to help him because we're taking a family vacation in March with the kids and the dogs to Florida. I would love to find something else to help him versus having to sedate him. Any advice would be much appreciated. Thank you. Well, number one, sedation is not the way to work with these things. I'm glad you brought that up. You can get sedatives. Some veterinarians may even prescribe them. The trouble with sedatives is that the dog can be so sluggish as to be physically unable to manifest his fear, his anxieties, and because they can't act it out, which by the way helps, all that panting and pacing actually is a comforting type of behavior. If they can't even do that because they're just completely sluggish from the sedative, they can be in what we call a chemical straitjacket, where they actually get more anxious, more freaked out, only you just can't tell. So sedatives, no, those are off the table. There can be a few different reasons why dogs can show pacing, panting, and reactive behavior in the car. Some of them are looking out the window a lot or all the time and just freaked out by all those creatures and vehicles and people and other dogs they see whizzing past. And they just can't get to them. Whoop, stay with me, girlfriend. They can't get to them because they can't get through the window. And that artificial barrier of the window is what drives them crazy. Those dogs do best in a fabric collapsible crate in the back of the car, not in the trunk, where the windows are zipped most of the way down so they can see out at the bottom just a little bit, but they can't see outside the car. On the other hand, if Percy is not watching out the window a lot of the time, and he does quit his panting and his pacing when you stop the car, and you do not see any drooling or any tendency to vomit, or you see no problems with him laying on the floor of the car, then those are situations where we probably don't have motion sickness. So, with what your description is, I will take your word for it that he is probably anxious in the car, and what I'm going to suggest that you do is have him ride in a fabric collapsible crate. They're not that expensive, and they're collapsible, very small, so you can hide them behind a piece of furniture if you want to at home, or leave them in the car, and you can zip those windows down. You can try some Dramamine 2, that's the Roman numeral 2. It has meclizine in it, M-E-C-L-I-Z-I-N-E, and meclizine is something that helps reduce motion sickness if you're concerned with that. But if it's an anxiety problem, then you can simply avoid him seeing out of the car. Again, I can't officially recommend the Calmer Canine to treat travel anxiety, but we know it's been helpful for a lot of anxiety disorders other than just separation anxiety. But I would try to protect that guy from seeing out the window and start with that. So thank you for that question, and it would be helpful if you let us know on the Calmer Canine Facebook page what those trials, how they result. We've also got Liz here, and Liz says, my dog follows me around the house while I'm home. Is that a sign of separation anxiety? If I'm staying in the same room, she will lay down, but as soon as I get up, she follows me. Well, let me say this about that, Liz. That's called overbonding. And it used to be believed that dogs who were overbonded, who would follow their person everywhere. In fact, if you're sitting still, being quiet, and your dog is nearby and appears to be asleep, try to get up and sneak out just soundlessly like a little ninja and sneak out of the room and see if your dog notices. And the dog who never misses it when their person gets up and leaves the room is a dog who isn't actually sleeping completely. That's a dog who has a moderately low level of anxiety pretty much all the time, waiting for the possibility that the person is going to get up and move around. So even when that dog isn't following you like your shadow, he's probably pretty anxious. And so what I'm going to encourage you to do is video that little rascal in your absence. You can use a smartphone propped up against a couple of books. You can use a video indoor surveillance system. You can get them on the internet for about $100. You can get an app for your smartphone, so you can do all your normal preparations to leave home, get in the car, and drive away, because they listen as the car departs. And then you can take a look while you're parked a couple blocks away, and you'll see what the heck's going on. Overbonding, that is following or shadowing, isn't something that is always hand in hand with separation anxiety. It used to be believed that it was. But there are some separation anxiety dogs who don't follow, and there are some dogs who are overbonded like yours who don't have separation anxiety. But if you do have separation anxiety in that dog, and you will know for sure by having a look at the video, and by the way, if you have a veterinary behaviorist or another qualified animal behaviorist that you can see with your dog, be sure you show that video, because we are trained, among many things, to recognize the body signals. And if that dog has separation anxiety, I'm going to urge you to go with the Calmer Canine like right away. Thank you for bringing that question up. Cassie had another question here, and she said, my dog gets anxious around children and men. He has never had a negative experience with either of them. Any tips to help him feel more comfortable? Well, let me explain how that problem probably got started in the first place. Dogs have developmental changes in their brains when they're little tiny puppies. And as much as developmental changes have been studied in babies and toddlers, they have in dogs as well. And we know that between ages 5 and 12 weeks, we have what we call the sensitive period. This is when they are open and amenable to socialization. You hear people use that term on dogs of all ages, when in fact, when that window is closed at around 12 weeks, there's another little brief window where they can be exposed to different kinds of places between 16 and 18 weeks. But that's when, ideally, we expose puppies to all manner of different kinds of people, different sizes, men, women, children, different races of people, in safe conditions. Nobody scares puppies, but they learn that, gee, all these different kinds of creatures are actually okay. You know, they can go to people for a little snack. They can play gently with people of all sorts of descriptions and other dogs. And if you're going to have, even if you're not planning to have cats in your home, I like to expose dogs to cats when they're babies, because we don't need them to be frightened and possibly aggressive as part of that fear of a species or a type of creature they don't understand. Well, you really cannot go back with your puppy, Cassie, your dog, I should say, to puppyhood and socialize him. You can desensitize him to men and children whose appearance or actions your dog just doesn't really understand. But I'm going to start with explaining what not to do. Do not let anybody who this little dog of yours is not fully relaxed around, don't let anybody approach your dog or reach for your dog or lean over your dog. People want to do that. They want to say, well, here, let me help this dog feel better because I'm going to be real sweet to him. And they approach the dog and try to pick it up or lean over, and the dog just gets overwhelmed. You have to remember that our dogs, while they're domestic creatures and they belong with us, no question about that, right below the surface is all of their innate social behaviors that enable them to function completely normally in a free-living canine social group. If all of us humans boarded a one-way spaceship to Mars, our dogs would form up social groups, gather resources, and they would survive and thrive as they did long before they were, in our homes. My point is that if you had a free-living dog with all the time and space in the world to create distance when they got frightened, then they wouldn't feel trapped in confined areas. But we live in a house, a building with walls and a room, and so where's a scared dog going to go? So if somebody approaches your dog and wants to help, and the dog can just get more freaked out because it feels trapped. So the best thing for people like men and children to do is to sit on the floor very quietly, turn their side to your dog, because for a dog, the side turned is an indicator of, I mean you no harm. I come in peace. And they really do regard it that way. So you've got a person who does not look directly at the dog, but sees it through their peripheral vision, okay, no direct staring, side turned, and they get small, meaning that they squat down on the floor. And they have food. And they don't talk in a high little squeaky baby voice to try to make the puppy relax and feel happy. Puppies who are scared, adult dogs who are scared, that just makes it worse because they don't understand that either. People need to be still, not look directly at them, turn their side, and have a little peace offering. And a dog who starts coming to that, there's no great enthusiastic reinforcement, very low-key and calm, and repeat hundreds of times. And your dog may learn that certain men and certain children who are low-key and relaxed, food dispensers, who do nothing to trigger their fear, actually become good friends. And it takes a lot of patience. And it takes the right children and men who are willing to be helpful, but will certainly follow your rules. If they decide they're going to do it on their own because they know something that those of us who are residency trained in the research behind all this don't know, well, those folks aren't going to do anything but scare your puppy more. All right? Here's another question. Oh, it's the same one. Okay, sorry. Liz, I already asked. We already hit that one. Okay, here's... my dog follows me around. I'm home. Yeah. Okay, so here's back to Amy. She said she's a little bit better after 3 weeks with the Calmer Canine. She's in the cage all day because she started tearing up my kitchen cabinets. 6.5 pounds Chiweenie. I'm going to ask you to make a shift, Amy. And, you know, I was talking just a few minutes ago about doing a trial absence where you put the video camera out and you get in the car and do a 20-minute or less trial absence. And I'm going to ask you to do it without crating your dog, because almost all dogs with separation anxiety get even more freaked out in the crate because they don't have the natural choices that they should and would have if they were free living. Dogs are denning creatures for sure, and they like to be in the security of their den, but in the wild, there's never a door that's closed and latched that prevents them from leaving when they need to, when they want to. And you know, one of the problems with crating dogs with separation anxiety is that so many of them get so frantic and panicked that they'll start to rip and tear at the crate in an attempt to escape. Wire crates often are bent, and dogs have been known to fracture their canine teeth and cut their gums and break their nails in a frantic attempts to escape. So we try very hard not to crate them. And if you, on the other hand, withhold a meal prior to leaving, excuse me, Tony, let me show this food toy here. This is one of dozens of kind of food toys that are available. Food dispensing toys and puzzles. You can Google it. You can go to a local pet supply retailer. This particular one is one of my favorites. That is to give to dogs. I don't eat from it, thank you. But you can put dry food or canned food in it. This is called the Twist and Treat. And you can make it real easy for your dog to extract the food by leaving it pretty far gapped apart. And I would do that in your dog's case. But make sure that she's food motivated first, meaning that kind of hungry, okay? In other words, yeah, I know Amy's gone, but by golly, I've got to survive, right? So what the food toy does, and some of these are different shapes, and the dog has got to figure out how to get the food out of there, little bits at a time, and manipulate it, and work at it with their paws and their lips and their teeth and their brain. Get that darn food out. Well, this is valuable because it mimics natural foraging behavior. Dogs, yes, they're predators in the wild, and they will eat what they kill, but the truth is, in the wild, they don't get that lucky every day. So very often what they're doing when they're out there trying to survive, and they don't find bowls of dry food out in the wilderness, they have to find the food on their own, and they're usually coming upon carrion, some dead thing. And it might have been picked over by a couple of dozen other dogs already, but there's this little tag of gristle in there somewhere, and it might have a couple of calories left in it. And if I'm a hungry dog, then I'm going to get that piece of gristle and I'm going to survive another day. And they have in their brain the innate capabilities of reaching in there and manipulating that carcass to get that loose and to pull it out of there. So that's what the food toy mimics, is they've got to manipulate it and manage it and get the food out. And again, if they're hungry, like they would be in the wild, you don't starve your dog so they lose 5 pounds. You just withhold one meal that morning, okay? And drop this on the floor as you leave and say nothing as you leave. It's essential to behave just as a canine leader would. And when they leave the territory of the group, they say nothing. Unlike us, we go off to work or school and we hug and a kiss and drive safely and be back as soon as you can, and we'll look forward to you coming home and all that stuff we say to people in our family. Dogs don't do that because they're different. They're not little people in furry suits. They're members of a different species. And when their leader leaves the territory to go off and sniff and investigate the neutral turf beyond, which they all have to do at least a couple of times a day, which is why we take our dogs on leash walks, by the way. When they leave, they say nothing at all. They just leave. And when they get back, same thing. It is a non-event. And we can inadvertently fan the flames of our dog's separation anxiety by making a fuss about leaving and returning, because the dog goes, "What the heck's wrong with this picture? You're my canine leader. You're supposed to know everything about canine behavior," and they believe we do. So if you make a fuss where they don't expect that from their leader, then the dog can attach even more anxiety to the event of their person leaving and returning. So act just like a canine leader. Just leave. And when you come home, just come home. You should have all the enjoyment and activity and fun and playful, goofy stuff you love with your dog, just never associate it with leaving and returning. But when you do leave, drop the food toy on the floor and put something really tasty in it, at least initially. Later on, you can just put regular dog food in it, and your dog can extract all of her nutrition from food toys and puzzles. But to find out if your dog will actually go for a food toy, drop it on the floor with something really tasty your dog really enjoys, and then leave, and then have a look at the video and see what's going on, and see if your dog will focus on survival outside the crate. And boy, that's one of the most important objectives. Now, back to treatment, there are certainly anti-anxiety medications that can be essential to these things. Let me show you a little bit about what this looks like. Miss America, honey, would you sit up, please? That's a big girl. Now, she's wearing the... Sorry there, Tony. I bumped you. She's wearing the vest. So to start a session, you push that button. You see the light flashing, okay? And then it's got this little Velcro type of an attachment on the back. I don't know if you can see that. But her little vest that she's wearing, it comes with the Calmer Canine. You just stick that to the Velcro, and you can see her wearing this thing. And I can sit with her, watch TV, answer my email, eat my breakfast, whatever. And she has this thing on her little self, and it targets the amygdala, the fear and anxiety center. And so I'm going to encourage you. You've got 3 weeks on the Calmer Canine. Keep going. Go out at least 6 weeks. And I would also find a veterinary behaviorist in your area, because there may be additional behavior modification and management changes. And in some of these cases, medications can be added. There's nothing in the world wrong with that. And in fact, don't forget that these anxieties are a problem of the neurotransmitters. These are the chemicals that transmit messages between neurons in the brain, and they can be way out of adjustment. And these medications are very safe, and they can make a big difference. Calmer Canine is very safe. You're already using it. I suggest give it its full 6-week run. And if your videos show that your dog may be better but still has a problem, see a veterinary behaviorist. I would also encourage you to monitor those videos and see about those food toys and see if you can get out of the business of crating your dog. All right, so what else? Okay, if my dog follows me around, okay, I think we talked about that. All right, so let me talk about a couple of these other stories here that we got. Lizzie writes in and says, "What does it mean if my dog constantly shadows me?" I think we talked about that. All right. Teresa, "When I leave my house at times without my dog, she's really barking and she pees and poops on the floors. And my dog doesn't like loud noises. Motorcycles, semis, shotguns going off on July 4th, cars backfiring. You know what it sounds like, Teresa, is that your dog has not only got a problem with separation anxiety because of all that barking and crying when you're gone, and defecating and urinating in the house while you're gone, and other manifestations, including reactive to sounds, like motorcycles and semi-trucks and stuff like that. We very often find dogs with separation anxiety have other anxiety-related behavior disorders. Call those comorbidities, which is really a medical word that means there's more than one thing going on at the same time. And again, we found that the Calmer Canine, here, girlfriend, sit up so people can see that. There you go. See, she looks like a little angel wearing it. She is sort of like a little angel. She's a beauty queen, too. That's why her name is Miss America. And so, yeah, you may find that the Calmer Canine is helpful with that other stuff, too. There's another wonderful product, I wish I had one here to show you, called Mutt Muffs. They look like earmuffs that people wear in cold weather. They're a very well-made product that come in different sizes, and they fit really nicely around a dog's ears and comfortably, and they diminish the amount of sound coming in tremendously. So for dogs who are noise reactive, Mutt Muffs can be one more thing that can be very helpful. And so I'm a believer in anything that'll help. I mean, truly help. You know, some people reprimand or shout at their dogs, and you know, people can even get desperate and frustrated and physically punish their dogs. And, you know, we should caution against that because there's always another way. The trouble with punishment is that we're punishing an internal brain disorder. It is a physical disorder on the microscopic nerve cell level and on the neurochemical or neurotransmitter level. And you punish those physical problems and they only get sicker. And so what we need to do is take that step back, have a few deep breaths and go, how about we get some professional help and figure out the causes and find some research-based behavior modification and other treatment methods. And, you know, speaking of research, the Calmer Canine is very well supported. In fact, there are devices like this that are used in people too. So for serious anxiety problems, you need modern science, and we've got that. So do your best to be a good leader. And you know, when it comes to good leadership of a pet, it really is going to challenge your abilities to be empathic. But if you already have a pet in your life, you're somebody who understands empathy. I mean, we all know friends who don't have pets, and that doesn't mean they're not good people and doesn't mean they aren't capable of empathy. But when you have a member of a different species who's, you know, they look different than we do, well, they think differently. Some of their behaviors are very much like ours, but there are others that are actually pretty darn different. You know, people, children, for example, and some adults can have separation anxiety, but they don't try to rip the window blinds off and tear the door frame off and, you know, house soil, do they? So we're going to see different manifestations, but anxiety is a common problem. We have a lot of it. Our dogs have a lot of it. And to really understand it, to take yourself out of it and recognize that this pet needs pretty serious help. And if you're not trained in this stuff, you know, for example, if you haven't done a residency in behavior medicine like I have, or you don't have an advanced master's or PhD in behavior, then you're going to need somebody who does have that training and does have those skills, is going to find all of the behavior issues that your dog has, not just one of them, recognize your dog's individual issues, but you're going to have to apply new methods, and you're going to need to apply your empathy. You're going to need to listen with your eyes. You're going to watch your dog who does not speak a human language, and you're going to say, okay, what am I seeing here? And if you're not clear on it, then an expert can help you, a trained professional, and we can find what's going on with your individual pet. You know, we don't solve all these problems. Medicine is not 100%, but we can make an enormous difference in almost all of them if we take the time. So anyway, I want to thank everybody who sent these questions. And here's another one. Oh, Donna, my Sheikah and Cagney are around me constantly, especially since my husband's death. Well, these things are really hard. You know, dogs are such social creatures. We're considered a social species, our dogs even more so. And clearly, Sheikah and Cagney were very bonded to to Donna's husband, and he's passed on, which, by the way, obviously is affecting her a great deal. And, you know, oftentimes people say, well, my dog senses my emotions. Actually, your dog is reading your body signaling and missing nothing. Now, of course, that's human body language that we show, and our dogs, of course, understand canine body language. And that means that they might misinterpret a little bit of it, but they miss none of it. And so you've got somebody who is missing her late husband, Donna, I bet you're pretty sad a lot of the time, and my heart goes out to you because I know how hard that must be. And your dogs are not only missing your husband, but they are empathic toward you. And your emotions are, of course, affecting them. And please don't feel bad, because that's part of living in a group and a family. And your dogs are your family. So I believe they think I'm not going to return when I leave. You might have a point there. If they're depressed about the passing of your husband, depression and anxiety, they're not opposites, and they can certainly happen all at the same time in the same individual. So yes, they may have separation anxiety. They might have had separation anxiety to some degree before your husband passed. Oftentimes we find dogs who are predisposed to it, which, by the way, is very often genetic and often influenced by events in a dog's life. And they might be kind of coping with it and doing all right, and their person never knew. Donna never recognized the signs because they weren't very noticeable. And then a big change happened. And sometimes it's a small change that sets a real anxiety problem into motion. It may be somebody in the family having a different work schedule. It can be somebody in the family going through another loss, or just being physically sick. But dogs who are barely hanging on with their show of normal behavior, when in fact their separation anxiety is just below the surface, and then some change comes along, a very big one like the loss of your husband, and then your dogs, now they really have signs of separation anxiety. So there could be a few things going on. They are really happy and spoiled dogs, though. Well, spoiled is not a bad thing. You treat them well. I wouldn't call that spoiling. I love them dearly, and I hate leaving them for even a minute. And my advice to you is find out what's really going on when you're gone, and be sure that if your dogs are food aggressive, and many dogs will compete for food, and that's pretty normal, actually. And so you could try a couple of trial 20-minute absences with your dogs in different rooms, and leave a surveillance video camera on each of them with a food toy, and of course withhold food first so they're motivated. You could try them together if you've never seen a problem with food aggression between them. Many dogs don't, so I'd say go right ahead and give that a try if you're pretty sure there isn't going to be a problem, and see how they do with a healthy, natural canine behavior. You can also use through a dog's ear, which is music that was scientifically developed as to have a calming effect on dogs. So that's always valuable. And by the way, beyond the videos, I want you folks, anybody who's got even a remote suspicion that they may be dealing with a separation anxiety issue, go to the Calmer Canine website, CALMER, the letter K and the number 9.com, calmercanine.com, and take the separation anxiety quiz. And on the Calmer Canine, let me start again, Tony. I'm trying to get there we go. On the Calmer Canine website, you're going to see the picture of this cute little dog here. This is sort of a little logo creature wearing the halo of the Calmer Canine. And there is a quiz. It takes like 3 minutes to do it. I've done it myself just to see. Questions are very direct and straightforward, and it helps you to determine what the symptoms are that your dog has, and will immediately give you an evaluation, mild, moderate, severe, and send you an email that you can print out and show to your veterinarian or to another qualified behavior specialist. And that Calmer Canine quiz can really help you understand what you're dealing with. So I'm going to encourage you to go to Calmer Canine, CALMER, the letter K, the number 9.com, and take the quiz. And the videos would be great. That quiz is really helpful too. And make sure that you understand whether you've really got a separation anxiety problem or not. You need an answer on this thing. So I think I've got one more thing I want to run past everybody. I've got a wonderful story here about a case I saw recently. These folks did take the Calmer Canine quiz, and they brought their dog in to see me. This dog its person is a lady named Wendy. She's a registered veterinary technician, which is a qualified nurse in veterinary medicine. And she has a few dogs, and this particular one's name is Daphne. Daphne is about a 6-year-old pit bull, very sweet dog. And she knew that this dog had anxiety when she brought it to me because she took the quiz. And it also had a problem with resource guarding with her other dogs. And you got to be careful. You get a lot of pets, and pretty soon they're crowded and they start to act out. So be very careful. And after I did a really thorough evaluation of Daphne, I found that she had severe separation anxiety, and she was overbonded to Wendy, her person, and she was attention-seeking, which is not a healthy behavior, and she had fear of unfamiliar people. It sounds like a litany of these other cases we've talked about. And she was aggressive towards other dogs, and particularly toward one of the other dogs in Wendy's home. And they would compete over toys and food and favored resting areas. So we had a lot of problems here, and I gave her a great deal of instructions. One of those was that she was crating Daphne. And I said, Wendy, let's try to get the heck out of the crating business. It's probably making things worse. It almost always does. So I had her do a trial absence with a food toy, and she found that, hey, Daphne was starting to do a lot better. I also told her right away, I think she ought to order a Calmer Canine and get started with that. And, she's got all these other dogs to look after, and I gave her a whole lot of instructions. Well, we had a follow-up consultation 6 weeks later, and I said, well, so did you get started with a Calmer Canine? And I was prepared for her to say, well, no, we didn't think we'd have time or something like that, And she said, oh yeah, got started with it right away. I said, and? And she said, she's better. Her separation anxiety, as she had watched the videos, and I saw the follow-up videos too, she was significantly calmer. She was no longer crating Daphne, and she was less fearful of unfamiliar people. So I made sure that she didn't allow any people this dog did not know well to approach or lean over or reach for or stare at Daphne. But the Calmer Canine had a great deal to do with it. And so the Calmer Canine, by the way, you can get it on the Calmer Canine website, CALMER, the letter K, the number 9.com. And you can get these things with the vest like Miss America's wearing. You can see that. They're cheaper if you just buy the little halo-shaped device. And I really would encourage you to, Tony, you're stepping on my notes here, little guy. I wanted to share the cost with people. Thank you very much. And the Calmer Canine, the cost, if you get the vest, depends a little bit on the size of the vest. When I ordered one, they sent me one actually. This is what the box looks like. And I'm sorry, Tony, I bonked you. And you get the booklet, and it's very straightforward. And they explain how it works and how to use it. But I got a medium one for Miss America because of her size. But they come in multiple different sizes because you want the thing to fit snugly, comfortable, but snug, so that when you put the halo on, it's in the right place and targets the amygdala of the brain. But depending on the vest size, the cost on the Calmer Canine website is $229. And if you decide that you just want to hold the little device, the halo-shaped Calmer Canine device, against the back of your dog's head for 15 minutes twice a day, you can get it for $199. But I think people are going to thank you, darling. I think people are more prone to use these things when it's easier, and it's pretty much hands off. I mean, she just sit here wearing this thing, and she doesn't notice it at all, and it's a lot easier than holding it there. So saving $30 is, I wouldn't. I just get the whole darn thing because that way you can use it. So I think that you're going to really want to take that quiz. They'll ask you for your email address so they can send you the results right away. And you're going to want to know if there's any question at all. You want to put the well-being of your dog out there front and center and take good care of her. So thanks for tuning in, and thanks for all those good questions. Gave me a chance to teach people some stuff, and I love to do that. I think the very first thing I'm going to ask everybody who's watched this to do is to go to Calmer Canine, C-A-L-M-E-R, letter K, the number 9.com, take the quiz, and then show it to your veterinary professional or your behavior trained. Some dog trainers are pretty well trained in behavior disorders. Somebody who can do a good job for you, help you out with this thing. So thank you, and remember, Thunder shirts are for dogs, and CBD oil, maybe. I'm not going to endorse it, but some people have said that it helps. I've noticed that people have noticed a moderate difference with mild to moderate behavior anxiety-related disorders. But if you have a severe problem, you need real science. And so the Calmer Canine is a much better way to go. So thanks for tuning in. Have a great week.